This video is the Chapter 9 overview. This video overview is to give you an idea of what will be covered and what you should focus on in Chapter 9. It should not replace reading the chapter for important details or completing any activity. Chapter 9 continues the focus on insurance. In this case, the focus is more on health insurance. In health insurance planning, you want to consider medical expense insurance and disability income insurance. As you can see in the insurance planning graphic, you want to set your insurance goals. You want to develop a plan to reach those goals. You want to put the plan in action, and you want to check your results. A similar planning strategy that we've used throughout the course. Group plans covers most individuals without a physical within the group. It's usually employer-sponsored, and an employer pays part or most of the cost. Of course, these are the best kinds of plans usually. Many times it's much more expensive if you are an independent, you work, you have a business and you have to go out and look for your own insurance that's not in a group plan. Major provisions in a health insurance policy. The co-payment. This is the cost sharing in the form of a flat dollar amount you pay, such as $15 per office visit or $10 per prescription. Service benefits, entitlement to specific services. Benefit limits, maximum dollar amount or maximum number of days in the hospital. A health insurance plan should offer basic coverage for hospital and doctor bills. Provide at least 120 days hospital room and board in full. Provide at least a $1 million lifetime maximum for each family member. Pay at least 80% for out-of-hospital expenses after a yearly deductible of $500 per person or $1,000 per family. Impose no unreasonable exclusions. Limit your out-of-pocket expenses to no more than $3,000 to $5,000 a year, excluding dental, vision care, and prescription costs. Although health insurance plans vary greatly, all plans should have the same basic features. So you want to use this as a guide when you're planning your health insurance and comparing. Private health care plans are HMOs, which are health maintenance organizations, PPOs, which are preferred provider organizations, and point of service, POS, combines the features of HMO and PPO. You want to read more about these in the textbook so you know what kind of plan you're looking at. Government health care programs, or Medicare, federally funded health insurance program, covers those age 65 plus and certain disabled persons. Does not cover everything. The patient is liable for the difference. There are 4 parts: Part A, Part B, Part C, and Part D. Medicaid, medical assistance offered to certain low-income individuals and families. It's administered by the state. Its typical benefits are physician services, inpatient and outpatient, hospital services, lab services, skilled nursing and home health services, prescription drugs, eyeglasses, and preventative care for those under 21. You also want to consider disability income insurance. Some disability insurance benefits through Social Security if you pay Social Security. You may want to look at other options through your employer. Sometimes there are limitations if you don't sign up at the time of hire, and there may be other limitations. Sources of disability income are workman's comp, disability from an on-the-job accident or illness, employer plans, short or long-term group disability policy. Social Security covers total disability lasting less than 12 months, and it usually starts in the 6th month. Private income insurance programs supplement other income sources, normally provide 40 to 60% of the income. This chapter finishes up with discussing why healthcare costs have risen. Be sure to read the entire chapter and focus in on the details for health insurance. End of video.